can't believe it's been almost 2 years since you and I had that conversation on set. And here we are again with another variant of COVID, and we're seeing the struggle again for tests. I wonder how you would compare this time around versus then. Are you able to get enough tests in your hospitals and your facilities right now? And are the labs able to work through those results fast enough?
So you're right. Every time we've had this conversation, I've brought up testing. Testing is still a real challenge, and we've had to take it into our own hands here at Atlantic. We've done over 1 million COVID tests since the beginning of the pandemic. We've invested, tens of millions of dollars into the testing platforms, and that's now given us a reliable way to get results quickly for our communities and our patients. But without that, we'd still be in a pretty difficult position.
So what are you seeing in your hospitals and your facilities right now? I mean, we know we're seeing record COVID cases. We know hospitalization rates are ticking up in some cases too. Is it folks that are coming in because of COVID, or is it folks that are coming in and they're testing positive for COVID while they're there?
So at our command center call that we had this morning at 7 o'clock, we have about 500 patients in our hospitals here in New Jersey, and we also have another 100 at a hospital at home program. The good news over the last couple of days is we've seen a flattening of the increase. We had been increasing about 10 or 11% per day, and now we've seen that flatten. Our modeling shows us really peaking next week and then heading down based on the experience that we've seen in other countries. So we saw a bit of a glimmer of hope today. But the patients that are in the hospitals, about half of them are people who come in with something else. And when we do the pre-admission testing, we find COVID. So it's endemic in the community. A really interesting statistic that I heard today, though, is that if you look at our current population, if you're boosted and in addition to your vaccine, those are only about 7% of the patients. So think about it. Over half are not vaccinated at all. A little less than half are vaccinated, but those who are boosted are doing really well. And, that's my plea to communities: get boosted.
I mean, speaking of vaccines, as we speak right now, the Supreme Court is hearing arguments about the federal government imposing vaccine mandates, including on healthcare workers. How have those mandates affected your company and your hospital system? Do you have enough workers in light of those?
Sure. We have in place a mandatory process for our team members to get vaccinated or have an exemption, and that's worked quite well. At the beginning, it was a choice, and then once the federal government directed us to do that, we moved forward. But I do think that we have to, as a country, get vaccinated and get boosted. And I know the politics of this are toxic, but from a public health standpoint, we've got to do something because the healthcare workers are just getting really fatigued with this ongoing pandemic, and we're seeing a lot of early retirements. You've described the staffing challenges that exist in our field. And we've had to do a lot of really innovative things to make sure that we've got the team members in place to take care of our communities. But getting our patients vaccinated is really important.